Hello friends, Dr. Larry Mitnaul, your friendly neighborhood child and adult psychiatrist, and welcome back for another episode of kind of an Explain That, where I'll jump into depth on a particular topic in psychiatry or psychology that you've been asking about. And so you may have seen a video several weeks back in which I was interviewed on seasonal affective disorder by our local news media. And so the news often has limited space and time to cover any particular topic in significant depth. And so several of you, no surprise, asked if I could spend some time explaining and giving a little bit more detail to some of the information that was offered there. And so because you asked so nicely, I'm going to get into it here. Now, you'll want to stay tuned because we'll talk about what the term seasonal affective disorder means, ways to recognize the disorder both in older kids and adults, some theories for what we understand about the brain and what might be going on there to kind of cause this syndrome, and what we might consider in terms of helping someone to better manage or overcome what they might be experiencing. So keep watching and we'll get right to it. Now, before we talk about curing winter blues, one of the ways you could help us wish the winter blues away is by smashing the like and subscribe buttons. I know, it helps our community to grow in the service of, really just reaching more people, more families and individuals who could benefit from a little bit of the insight that we offer here, both on terms of the brain and the mood. So thanks for joining us in this mission, and let's get to it. So this is the time of year when psychiatrists and therapists are being sought after to help or for guidance when people are experiencing what might be called winter depression, winter blues, or seasonal depression. And most often people may describe feeling a distinct change in their mood and energy levels that seem to correspond with the changing season. The Diagnostic Manual of Mental Disorders, or the DSM-5, as we call it for short, it's kind of the psychiatric Rosetta Stone for determining diagnoses, refers to the formal disorder as a distinct type of depression known as major depressive disorder with seasonal pattern. Major depression for us often signifies intense or profound sadness that is really functionally impairing, meaning that it interferes with a person's day-to-day activities like getting up in the morning, getting ready for work, and maybe engaging in school, or it affects their relationships. And so I want you to imagine with me a person who is maybe struggling to do some of those things and struggling to really get out of bed. Perhaps their sleep has increased to 10 or 12 hours, but they still just don't feel rested. Perhaps their weight has increased as their appetite has kind of grown. And they've noticed that during this time of year, they typically just don't feel well, even though in the preceding months they have been doing fine. And so this might be their second or third winter in a row in which they've been stuck in this significant downshift in their emotions. And so one of the things that I might consider for this person is, do they have seasonal affective disorder? So here I'm going to use seasonal affective disorder, or SAD, instead of saying major depressive disorder with seasonal pattern, really just for obvious reasons to facilitate our conversation and to not get bogged down in some of the labels. So you might be asking, how common is this? Well, an American Psychiatric Association paper estimates that 5% of adults in the US experience and meet full criteria for SAD. And in addition to that, there are probably 10 to 20% of adults who may experience at least some mild symptoms of seasonal affective disorder. And so in kids, it's a little bit harder to get really concrete numbers as to how prevalent this is. However, when we look through the full developmental lens and kind of framework, it appears that it is much more common in older teens and maybe younger adults than it would be at young kids. So this isn't typically a conversation that we're having at the really young ages. Also, there tends to be a significant difference between men and women. So for instance, women appear to be about 4 times more likely than their male counterparts to experience some of the symptoms that we'll talk about. So interestingly, but perhaps not surprising, studies are also pretty conclusive that geography and where you live really make a difference. So the further north you go, the greater the increase in symptoms. So, for example, some studies show as much as a 8-fold increase in New Hampshire or Maine as compared to Florida. So, if you needed more evidence for why snowbirds exist and why that's such a thing, well, there you go. So, you might be asking, so what might we see? In the example that I highlighted earlier, probably a few things stood out to you about that example, and a lot of those things kind of map onto the criteria that we might use in thinking about whether someone has seasonal affective disorder. So one is, changes in mood, and that might be anger, irritability, or sadness. Maybe feelings of significant fatigue, or feeling just more tired than they usually do. Changes in sleep habits, and that could skew either way. So either someone's sleeping too much or maybe too little. Withdrawing from other people or withdrawing from things that people normally enjoy. Now, that might be a little bit harder to distinguish this season depending on the amount of social distancing a person might be engaged in, but those are some of the patterns that we look for. Sometimes there can be unexplained kind of aches or pains as well. And then increases in appetite and also weight gain can be another feature. So what are some of the leading theories about how we understand this? Well, one is that lends towards our circadian rhythm. So that's our internal clock that helps us to pace the time of day and our energy levels. And so the change in daylight and your brain's perception of it that occurs each fall, this, it turns out, may alter your body's ability to really kind of recharge in a healthy way. Also, some studies have implicated serotonin, that serotonin levels, they tend to change between the seasons. And so if you may recall my article on temperament where I reviewed some of our growing knowledge about serotonin and what its role might be in terms of our brain and our mood. So definitely check that out if you haven't. So as always in psychiatry, we like to investigate if there are other causes that are maybe leading to some of this seasonal sadness. There are experiences or medications or conditions that can mimic feeling sad. So if someone has had a traumatic experience that occurs around this time of year, certainly that can trigger a similar collection of symptoms that someone might see. Also, there are just illnesses involving metabolism, like with calcium levels or sodium as well, that can mimic sadness. Certain medications used for blood pressure or allergies or hormone regulation can also cause these types of changes as well. So if someone is seeing a psychiatrist or a medical professional, they'll certainly get questioned about signs and symptoms of some of these things as they match up with some of the symptoms I've described. And perhaps that might lead to a few further tests to really determine whether they're having, whether some of those things like medications or other medical concerns are having an impact on someone's mood, especially during the season. So what do we do if this is you? Actually, sorry, that kind of sounds like a Dr. Seuss rhyme. So what would you do if this happened to you? Actually, that actually might be from Dr. Seuss. So the most important thing is to talk with someone like your doctor or therapist about the symptoms you've been having or someone around you's been having to really determine if you or someone you know meets the full criteria for seasonal affective disorder. These symptoms can come in degrees of severity, and so how we help people is related sometimes to the severity of the symptoms they're experiencing. For instance, vitamin D, good sleep hygiene, right, might be among the things that we're recommending to people. And again, I'm going to refer to one of my previous videos on the topic if you haven't seen that. And then exercise, which is often neglected during the season as well. And of course, last but certainly not least, is to get more sunlight and to increase that as part of your experience during the day. Again, I'll just cheat and give you a little snippet of some of the things I mentioned in the sleep hygiene video. But here are a couple of tips. So things that we might look for, recommend, are eliminating long naps, turning off all screens an hour before bed, keeping a regular schedule even on the weekends, maybe avoiding taking things that delay sleep like caffeine later in the day. So those are the types of things. And then again, in terms of the light therapy and getting outside, so being outdoors is just really, really beneficial. Now, it turns out that there are other ways, artificial ways, to also try to increase that. And you might have heard of something called a light box, or sometimes they'll refer to as sad lamps or happy lamps. These have particular specifications. They have a lux rating, which equates to the kind of amount of light that they emit. And so 10,000 units is often what we're looking for, and typically someone might spend 30 to 60 minutes kind of beneath one of these to help their symptoms. And so there's some important things to review about how to appropriately use, a lamp or light box. And so those would be things to certainly talk with your professional about, just to be sure that you're aware of kind of the ins and outs of that before you jump all in. So as always, since we're talking about sadness and depression, if you or someone you know is having thoughts of self-harm or self-injury, or thoughts of just, not wanting to be alive, it'll be important that you get urgently evaluated to help develop a plan to help you to live your fullest life. Guys, as always, I'm really appreciative of the time that you've spent here. Hopefully you've learned a little something about your brain, about your mood, about this season. I want you to stay tuned because we have some really great and cool developments coming through this next year of 2021. And as always, take good care, my friends, and be well.